Dr. Prerna Varma, thank you so much for doing this. It's so fun to have you here, and this is a real treat for us. When it comes to being awake for a long period of time, how does wakefulness and being awake for an extended period of time affect our cognitive function?
Well, in so many different ways. So, sleep is such a great way of making sure that your cognitive functioning and performance is great. We know from so many studies across more than 5 decades of research that there is this thing where when you sleep well, when you have 7 to 9 hours of sleep, when you feel that your sleep quality is excellent or really good, you do perform better. But on the flip side, we see that if you are sleep deprived, whether that's acutely sleep deprived, so didn't have great sleep last night, or whether that's a chronic sleep deprivation, so you haven't been sleeping for 7 to 9 hours on a regular basis, we do see a decline in cognitive performance. So, especially on sort of like measures where you're looking at your motor functioning or how quickly you respond to things, you see that that slows down quite a bit. I do find this fascinating that about 19 hours of wakefulness, so when you've been awake for 19 hours or so, your cognitive performance is somewhat similar to someone who has a blood alcohol level of 0.05%. So you're as performing as cognitively poorly as someone who has been awake for relative someone who's been drunk essentially. Yeah.
It's bizarre when you think of what professions would be likely to be that level of sleep deprived. It's the ones where we need them to be at their game the most, the doctors, the sort of
Yeah.
first responders, things like this. And before we got on, you mentioned a term called frontal lobe disinhibition. And I love that term because for me, it highlighted what alcohol seems to do, which is it releases the brakes on the frontal lobe, right? It sort of suppresses the frontal lobe a bit. And I'd never put the two and two together where your frontal lobe, I guess, disinhibition from sleep deprivation is an equivalent to frontal lobe disinhibition from alcohol. And so that probably explains why people can be a bit shoot from the hip a bit more when they're tired and say things they don't mean and just less breaks. Have I got that right? Is
Yeah.
that similar?
I do have to say that it's a self made up term. So this comes from a bunch of us when we were PhD students and used to do a lot of night studies. And we would have these like moments where we've done those night studies, we've gotten 3 or 4 hours of sleep, coming back to work, and that's when you could ask us anything and you'd get the most non-filtered, like really bizarre responses. And that's when we said that's because your frontal lobe is disinhibited. Like this is the period where you're not sort of thinking clearly. Your executive function is a little bit poorer. So that's what frontal lobe does. It does a lot of executive functioning for us. It does a lot of critical thinking for us. And when you are sleep deprived, that's the one that goes down the gutter really quickly. And that's what we noticed for us. So we just made up this term where we were like, okay, this is the period when your executive functioning is at the poorest. But I do want to come back to the point that you made about people who need to be performing at their best, or people who are sort of expected to perform the most, like our doctors, nurses, emergency personnel. And these are the people that are most, in a lot of ways, are the most sleep deprived. Just because, like, look at the shifts that they do 16 hours, 30 hours in certain cases, where junior doctors have such long shifts. And these are the people that are making decisions about our health and our well-being, and have to respond really quickly to things. And we do see that these are the people who are at the greatest risk of accidents and injuries. So there is so much research out there globally, that people who work shifts, who work 24/7, have about 2 times higher risk of accidents, have about, in certain cases, 150% higher risk of accidents once they finish their work. So if you're a doctor, there's a higher risk of you getting into an accident and coming back to your same hospital. And that just goes on to show how the people that are supposed to support us the most probably are the ones are not getting enough support in terms of their own sleep.
It's slightly ironic, isn't it? Right? It's the ones that are most able to help us are at most danger just purely by doing their job and the nature of the modern demands. I'd like to kick off there with sort of a rough guide of like how our sleep mechanism works and how our modern world and lifestyle can actually affect that for the worse.
Yeah. if you it's an interesting one, and I think I'm going to repeat something that you've already spoken in one of your previous podcasts about circadian rhythms. When we do talk about sleep, we should look at it from a three element perspective. So one, I like to call that as the brain's hourglass. So essentially, if one side of the hourglass is full, and you've been sort of awake for really long, your pressure to sleep or your hunger to sleep builds up, and that's approximately for most people around 16 hours in their day, which is when you're like, okay, I've been awake for too long, now I'm hungry to go to sleep. So that's one. The second is your circadian drive, which is basically your circadian systems, and we can get to it in a minute and talk about what circadian rhythms are and how they affect us. But that's essentially your internal body clock. So that's located in your suprachiasmatic nucleus, which is a mouthful to say. It's a small part within hypothalamus, which in itself is size of an almond. Um, just to give you a perspective of how small it is. But it does this like great job where it increases cortisol levels in the morning when you're supposed to be awake, when it's bright outside. And then during the evening, when the sun sort of starts to set down, that's when it starts to increase this melatonin, which is a neurotransmitter hormone that helps you fall asleep. Now, if you take away everything from I guess everything from the modern world and just leave it as is, you'll see that our circadian rhythms in particular are quite in alignment with nature. So the sun gets up, you start to get this spike in your cortisol, your heart rate increases, you're like up and awake, like ready to go on with your day. And then as the sun starts to go down, it gets dark outside. That's when your melatonin sort of kicks in and starts to flow, and you start to feel a little bit sleepy. Now, that's going to differ a little bit for different people based on whether you're more of a morning lark or a night owl, as they like to call it. But for most people, it would be relatively similar, like in alignment with nature. And what's happened with our modern society in some ways is it's gone out of whack in maybe an effort to sort of like elongate our days a little bit. We have become this dark deprived society in some ways, where like we have lights everywhere. It's like I have this bright light on right now in my house just to make me feel more alert. And that sort of affects your circadian rhythms, but also things like you have to go and visit your friends for something, or you have this like really long day at work and this is the only time you get to decompress. So all of those things within our modern society are almost misaligned with our circadian rhythms and what we need to do to get to sleep. So in some ways, you might even have to think about restructuring our society a little bit to get to a point where our circadian rhythms and our sleep is aligned to how the nature intended it to be.
It's one of these things that once you notice it, it's really hard to unsee. And as someone who cares about the health and, try and do everything I can to stay healthy and do all of that stuff, suddenly when you realize how out of whack your natural circadian rhythm is with the modern world, and suddenly I'm just terrified of artificial light when I'm not meant to, right? I mean, I'm walking back from the shop yesterday and the street lamps, I'm like, oh, this is going to affect my sleep. This is terrible. And it's really hard to avoid and it's really hard to get right. When it comes to shift workers, I think I'd like to explore it from the topic of, obviously they're such a vital part of our society. We need them, and there's all sorts of wonderful work they do. Sadly, it seems that the very nature of the job really is a struggle to get right from a health point of view. What can we learn from shift workers and what they have to go through, and what does that tell us about an ideal circadian rhythm?
It's a area that I'm really passionate about. I work with shift workers for a living, and a lot of what we see is that they're a prime example of circadian dysregulation or misalignment between your body clock and the external environment, and that happens in many different ways. So you sort of going from a 7 a.m. shift one day to a 7 p.m. shift one day, and like working all hours. But then your fasting feeding cycles, or when you're eating, also goes out of whack, because if you're awake during a night shift, you're obviously going to have food to sustain yourself, caffeine to sort of stay awake. And then you're then expected to sort of go back to bed in the morning when you're back from work. And what we see is that and you would probably find it if you speak to shift workers as well, is that they come back home after a night shift and they're extremely tired. They've been awake for 30 or so hours, but then when they get to bed, they can't go to sleep. And this is because of that dysregulation. So there's that sleep pressure, that drive to go to bed, but there's also that circadian misalignment where the sun is up, it's bright outside, and their eyes are like, oh my God, this is not like sleeping is not what I want to do right now. And that's what we see quite commonly in shift workers, is that they are sort of in that state where they're tired, but they're unable to sleep because of that sort of circadian misalignment. But also on a chronic level, over a number of years, we see that shift workers have a higher risk of adverse health outcomes. And we're talking about all sorts of adverse health outcomes, from cardiovascular diseases to diabetes to increased risk of heart attacks, including dementia and Alzheimer's disease, just because of how out of whack their system gets. And that's one of the prime reasons as well. I don't know about statistics from UK, but at least in Australia, we know that in certain professions, particularly with emergency personnel, with doctors and nurses, we do see that a lot of these people leave their jobs quite early just because their bodies can't take what circadian misalignment is doing to them.
Okay, wow, that's fascinating, also terrifying at the same time. Let's dive into circadian dysregulation and how light and melatonin play a role in that. So, sort of from first principles, for the listener who maybe not quite familiar with circadian dysregulation, how does light affect cortisol and then in turn this melatonin cycle, as far as I understand it?
Yeah. Let's if we take a step back for a second, what circadian system or circadian cycle really is, it's a natural oscillation. As many words, circadian on its own comes from a Latin word called circa, which means comes around. So essentially the way circadian cycle works is that there are some periods of the day during a 24-hour period where some activities are high. So for instance, you have more propensity to sleep during the night and then more propensity to be alert and awake during the day. And that's what the circadian system does. Now, for a really long time, we thought that the circadian system was just one thing, that is sleep and wakefulness. But what we are realizing and what we've seen over the number of years is that it's not just one circadian clock in our brain. There are also multiple peripheral clocks in our cells, in our tissues, in our liver, as well, which sort of regulate all our bodily functions. And that just goes on to show that all of our bodily functions in some ways circadian cycle. So that's one fascinating bit. But coming back to your sort of question around light and cortisol, is the fact that light basically is an indicator for alertness in the simplest terms. So light is that indicator of alertness. It's also that indicator that you need to get up, and which is why you have those spikes in cortisol as soon as you wake up in the morning. So that's the one bit. So that's what light does to you. But light is also an indicator of you don't need to produce melatonin. So it's that one thing where if I'm getting too much bright light in particular, somewhat similar to what I would get if I was out in the sun, that's an indicator for my body to continue producing cortisol so that I can stay awake, I can stay alert, I can go on with things throughout my day, but then also to reduce the amount of melatonin in my body so that I don't feel sleepy, I don't get tired, and therefore I can, again, continue with my day.
Okay, so that's really fascinating, because the way I'm understanding this is it's like our software is really outdated to the modern world. So much so, even if we had fires, right? So I guess the sun would be the only form of light that our software would be sort of able to reckon with, or our bodies would be able to reckon with. And then we have the introduction of fire, and then we have the introduction of fluorescent light bulbs. And so how does our body even deal with this new addition of light? I mean, surely most people must be in some sort of state of circadian dysregulation.
It's a very interesting point, and I think that is the case. Like a lot of us in some forms on a regular basis, in some ways, are definitely entrained to light, in the sense that if you think about how our body reacts to light on a sensitivity basis, so like whether you're sensitive to light and how it's going to make you feel, you'll see that if you get a constant state of light, your body's sensitivity to it would slightly decrease. So you'll get a little bit used to it, but then it's not going to be a complete sort of getting used to it in some ways. You're not going to get acclimatized to it in a completely same way that if you still keep on getting the light throughout the day, your melatonin would still get increased. So we do see that there is certain level of circadian dysregulation. It's a term that's commonly called social jet lag. So like when you're with your friends, if you're going out, if you're in the light, you're having fun, it just puts your body a little bit out of whack. And you might see that instead of, say, going to bed at 10, you're going to bed at midnight or even later. So there is that little bit of circadian dysregulation for most of us, unfortunately, in the modern world, no matter how much used to we get to all these lights around us.
Okay, so we can see the extreme consequences from shift workers, and then sort of stepping back a bit, if maybe we're not quite as severe as shift workers, but circadian dysregulation surely will have some health consequences. How important is consistency and trying to be aligned with that natural world when it comes to sort of getting away from circadian dysregulation?
We are realizing that it's quite important. So there is research from some of my colleagues at Monash, including Andrew Phillips, who came up with this phenomena, which is called sleep regularity. And they've been looking at some really big data sets, including ones from UK Biobank, where they've looked at how people who are more regular and more consistent with their sleeping pattern have better life outcomes than people who might not have the similar level of consistency. So what we do see is that if you think of sleep as a multi-dimensional concept, in the sense that you're not just talking about getting 7 to 9 hours of sleep duration, but you think of it as sleep quality and consistency as well. So you're going to bed at the same time, you're waking up at the same time. And we see that people who do have that consistency in terms of when they go to bed and when they wake up, and that is sort of routine for them for a really longer period of time, they're the ones that have the lowest risk of experiencing heart attacks, experiencing diabetes or other metabolic conditions than people who might have less consistency in their sleep or who might not be sleeping regularly. And a part of it, from a theoretical perspective at least, goes back to making sure that your circadian rhythms are aligned. So if you're sleeping at consistent times, you're likely getting light at consistent times of the day, you're likely avoiding light at consistent times of the day, and that's why your sleep is consistent in some ways. So it makes sense from a theoretical perspective that people who have regulated circadian rhythms, have regulated sleep, do have better life outcomes.
Okay, so it really brings it home for me when, just having this conversation, hearing you speak about this. On one end, we have all the severe health consequences of shift workers when they maybe aren't. I'm sure there's things to optimize and affect their circadian rhythm, which I'd love to ask you next. But if they don't focus on trying to get that circadian rhythm right, all the health consequences that can come from that. And then the other side of the equation, which is if you can actually, I guess, be in a state of circadian regulation, where you get consistent light in the morning, perhaps, and your body clock is aligned, all sorts of health consequences go out the window, right? You're much more healthy from a circadian rhythm. So, for the people who struggle to be in a state of circadian equilibrium or regularity, I think is probably the right word. What can they do? What tools can, I guess, shift workers or maybe new parents, other groups that fall into these categories? What can they do to help?
You make a really good point here that most of us can sort of try to get that consistency and regularity, but then what do you really do if you're in shift work or as now we see post-COVID world when we're all answering emails at any hours or working late through the night? Like, what do we do when we're in that state where you can't really have circadian regulation in some ways? And there are some, I don't want to say they're simple, but there are certain ways where you can address it. So some of the key things, at least in shift work, that we see is optimizing when you're getting bright light. So we know that if you're working, say, in a hospital, or if you are working in a manufacturing unit, etc., doing night shifts, one of the key things that you can do is get bright light during the shift instead of those like really dim, dull lights that are going to make you feel sleepy. So that's one. There are also things like bright light goggles that you can use where you can tweak the intensity of light. And we've seen in research that even 20 minutes of exposure to bright light glasses can help you entrain your circadian rhythms. And what that really means is that if you're someone who, let's say, is doing night shifts very often, like going back to back, just wearing those bright light glasses, you could potentially change your circadian rhythms in a sense that it aligns with your work, so that you feel your sleepiest when you are when you're back from work in the morning, and not
Right.
when you're working.
Okay, so you'd have to almost go, okay, body, we're not awake when the sun's awake. There's no sun, there's no light here. So we're going to have to bombard us with all sorts of light, and this is the time we'd be awake. So you almost hack your circadian
You
rhythm.
almost hack your system. The other ones that are quite important here would even be things like caffeine. So, for instance, during night shifts, obviously you don't want to have caffeine too late into the shift because you don't want to be at a point where you go back home and you can't really fall asleep. But you might want to take some smaller doses of caffeine at the start of the shift to just bring you to a point where you're alert and awake. And then when you do get home, even though it's bright and sunny outside, just make sure that your blinds are there, like it's just the blackout blinds. The temperature is at a point where it's conducive to your body. It's making you feel cool and you're like ready to go to bed. So it's almost like changing, as you said, like almost like altering the systems a little bit so that they match with your work life in some ways. We Within Monash, we do have some more recent research that I've been involved in. We've been working on an app called Sleep Sync, which syncing your body, like that's the sort of thing that we were coming up with. And it's built on biological models of sleep. And essentially, when are the chances from a circadian perspective? What are the chances that you're going to be most alert at what times of the day, when you're going to be most sleepy? And how do we tweak your sleep and light patterns, and when you get both of those, to ensure that you're most alert during the shift. So there are certain ways to have it, but this research in some ways, there's a lot that we've done, but there's a lot that we still need to do. There's a lot that's emerging.
Okay, well, I mean, while we're on it, then, what's emerging? What are you excited about?
Some things. I think one of my favorite ones is how we're sort of stepping away from one size fits all solution. So like I do get it. Like most of us have to get 7 to 9 hours of sleep. Most of us have to get consistent bedtimes. Most of us need bright light early in the morning to feel awake and alert and so on. But also the fact that we are realizing, and this goes for overall medicine in general as well, where we're getting to a point where we are realizing that there's certain groups that react and behave to different things in different ways. So we need to personalize medicine for them. And that's one of the key areas that I'm most excited about, is the opportunity to provide tailored interventions to people and tailored treatments to people. So if your circadian rhythms or your timing for sleep is different to mine, the interventions that I provide to you, or when I say go and seek light, is going to be different to the interventions I provide to myself. And we do see that, at least within shift work perspective, even on a night shift, the timing for when people are going to feel at their sleepiest, the difference between those times is about 6 hours. So you might feel sleepy at the start of your shift. I might feel sleepy at the end of my shift. So why should both of us get the same treatment? And And that's the thing that gets me most excited. It's like the opportunity to tailor things to individuals based on where they are with their circadian clock, where they are in terms of like whether they're a parent or not, whether they have people that they're caring for, what kind of responsibilities they have. Tailoring those treatments for them is both quite interesting, but also perhaps one of the best ways to make sure that people actually use them. Otherwise, if it's not going to align with what I do, I'm not going to use it.
I think that would be, I mean, I can see it's a vast opportunity to contribute something really positive and valuable for people. I mean, just off the back of this conversation, I've learned that, I guess, everyone's demands are so different depending on their job. So why should, everyone have the same bedtime, everyone have the same light exposure at the similar time, right? So if you had a technological innovation that could be tailor-made, I can see the value in that. That'd be really, really interesting. I'd love to dive into the 3P models of insomnia. What can you tell us what that is, and how does it help us?
Yeah. So when we talk about sleep disturbances in general and insomnia in particular, so insomnia is one of the most common sleep disorders that we see out there. It's when you have difficulty falling asleep or staying asleep, or you're waking up early in the morning or earlier than you would like to. And the 3P model sort of describes why insomnia happens. And it's also a way of ensuring how you treat it. So one of the P's is called perpetuate. Give me 1 second so that I remember which one is the first P.
I mean, I was reading the paper yesterday and this morning, and I thought it was so fascinating. I know a lot of people personally who deal with insomnia, and it's very hard to have the discussion because it's a lot of psychology in there. It's a lot of learned behavior. It's a lot of, so many variables, a way to look at it. I really thought the 3Ps were a really nice new approach I hadn't come across.
Yeah, no, it's a really cool one. And I often, when I think about like how insomnia could be dealt with, or what sort of treatments are used for insomnia, which we can talk about in a bit, I think we need to focus on all three of those P's to make sure that we're providing the best options to people. But I was like, I started talking about perpetuation first, so I need to go back to the main one for a bit. So the 3P model of insomnia is really just a way to describe why people may experience symptoms of insomnia and why those symptoms may continue. So one of the first P's, it's called predisposing factors or predisposition. So that's when there might be a biological reason. So you may have someone in your family that has experienced insomnia, or it runs as a condition within your family, which predisposes you to experience it. Or you might have other conditions that may predispose. So we know that people who are from neurodiverse communities or have experiences with attention deficit hyperactivity disorder or autism spectrum disorder, they might be more predisposed to developing insomnia. People who have depression or have experienced depression also have more predisposition towards experiencing symptoms of insomnia. Insomnia is also a factor that predisposes them to experience depression, but that's a different story. So there's that one aspect which we need to recognize, that some people might be more at risk of experiencing the condition, but then not everyone's going to experience it. And that's where the second piece sort of comes in, which is precipitation, which basically means that there's a reason or a factor that sort of puts you up the threshold and forces you to experience insomnia. In a lot of cases, we were just talking about this, in a lot of cases, becoming a parent is one. So you might be predisposed to experiencing insomnia, but till you become a parent and you have a child that's not sleeping and you have to wake up and take care of them, you don't experience it. So that's your precipitating. Other precipitating factor, one of the most common ones is stress. So some of the research that we did at the start of COVID-19 pandemic, we found that because of how I guess, confusing it was for people, how unprecedented it was. There were higher rates of insomnia. So people were stressed out, were concerned what's going to happen in the future, and that put them over the edge, or over that threshold. And then you have the third P, which is called the perpetuating factors. So you get insomnia, it gets worse for a period of time, and then you start to get better, but then there are behaviors that might keep on perpetuating it, which is when you keep on going back to experiencing those symptoms. And those could be quite a lot of things. It could be things like still having caffeine during the day because you experience poor sleep in the night. You get up, you get a cup of coffee, midday, you're like, oh my God, I can't deal with this day anymore. And you get another cup of coffee. And then back to night, you can't go to sleep. Or you have really bad sleep one night, and then you try to sort of catch up on your sleep. And instead of going to bed at your regular time, you're going back to bed at a really early time. So that is another sort of those perpetuating factor. And really, I guess, in a lot of ways, recognizing what those factors are helps you with when you go and seek treatment for it, or when you try to address it in different forms. So I really like to use 3P both in my research, but also when I'm trying to understand where people's experiences of insomnia are coming from, instead of saying use a band-aid solution, or like stop drinking caffeine, or like don't have alcohol before.
I mean, you mentioned the caffeine conundrum, and I think I think not many people are aware of the half-life of caffeine. I've read it's 8 hours. I mean, what is the half-life of caffeine, and can you speak to that a little bit?
Yeah, it's 8 hours. Some studies have suggested 10 hours, but in general, it's about 8 to 10 hours. So if you are someone who's taking caffeine at 2 o'clock in the afternoon, there's a chance that it's going to be in your system at 10 o'clock when you go to bed.
Right. Okay. I mean, that is just such a brilliant point to bring home. I mean, guilty as charged. I do try and cut it off before 10:30 at the moment, but easier said than done. What proportion of people who suffer from insomnia suffer from circadian dysregulation?
There is some emerging research on it, and it's a difficult one to, I guess, entangle where it's coming from. So when I'm not a clinical psychologist, by the way, so I don't see patients, so I can't speak to their experiences. But at least from a research perspective, it's a complex relationship, in the sense that you never know whether a person who is experiencing insomnia and is telling you, I go to bed at 10 o'clock and then I can't go to sleep till midnight, whether that's because they're worrying about things and they have insomnia, or whether it's just because their body clock or their chronotype is more towards the later. And from what I understand, when you do go to clinical settings and speak about your symptoms, the first questions that are asked are around whether or not you have a certain chronotype. That is sort of related to your insomnia system. Symptoms of insomnia. And it is quite possible that a lot of people who do experience those symptoms around insomnia are more circadian dysregulated, in the sense that, let's say, if I'm a person who is really late but has to go to work and reach work at 8 a.m. or 9 a.m., I'm going to force myself to go to sleep at 10, right? Just try to get my 8 hours. But then because I'm a later person, I might not get to sleep by midnight. That's where the circadian dysregulation happens. So sort of going back to like what we were discussing about the modern world, in some ways our modern world is constructed in such a way that a lot of people experience that circadian dysregulation. And the best way to, I guess, disentangle those relationships and see whether it's insomnia or whether it's circadian dysregulation is to speak to a professional. So try talking to your GP or a general practitioner or your psychologist, and speak to them and see where those symptoms are coming from.
It's really, you mentioned chronotype. Could you just sort of how do we define chronotype?
Yeah, there's a lot of myths and misinformation out there, so I'll try to keep it a little bit simple. In the simplest sense, chronotype is both your circadian is from that endogenous, like internal body clock perspective, but also your environmental perspective in the sense where you may have preference to do things at certain hours of the day. So when we talk about chronotypes, a more morning or early chronotype would be someone who likes to wake up early in the morning, say 6 or 7 a.m. They wake up, they feel alert by the time it's like 8 a.m., 9 a.m., and then they start to get sleepier towards the first sort of part of their evening in some way. So that's where their melatonin starts to pick up. And then you have certain individuals who just generally have a natural tendency to be later. So these are the people who might not get up till 8 a.m. or 9 a.m. or even 10 a.m., depending on how late you are. And therefore, they start to feel more alert during later on in the afternoon. I joke with my partner that I'm quite late as a chronotype. So like 9 p.m., I am as lit up as a Christmas tree. That's how alert I feel. And that's just how the natural tendency is. So we see that quite naturally. Even from an evolutionary perspective, we see that certain people tend to be more later people, enjoy activities later in the day. And then certain people are more morning people who enjoy their activities more during the early hours. But just that our society is sort of constructed in a way that all of us do, or at least most of us, like a certain hour, like to get up at 9 a.m., to work till 5 p.m., have to go on a commute at a certain hour. So that's one of the reasons why circadian mismatch or dysregulation happens.
Okay, so what are the? I guess so. Your chronotype is your natural. I guess, are you a morning lark or a night owl? What are the misconceptions around those labels of like, oh, I'm a night person, I'm a morning? Where do people get it wrong, and where is it actually consistent with the science?
So I don't know where to begin. But I guess the most common one that I've noticed is the tendency that people might consider morning people as like less lazy or more productive in some ways. I do remember when I was younger, and there used to be like these things on certain websites that I won't say which ones, but there would be things like all the CEOs wake up at 4 a.m. and go to work out at 5 a.m. And then by the time it's 6 a.m., they're like done with half of their day and so on. So that general perception around the fact that morning people tend to be more productive, later people tend to be lazy, and so on. That's one. But then there's also a little bit of misrepresentation in some ways, where we think that people, we initially at least thought that more evening chronotypes, so people who have that later sort of preferences, have a higher risk of depression, heart disease, and other metabolic conditions. And only now we're realizing that that's not necessarily because they're evening chronotypes. That's actually because their body clocks or their circadian rhythms are misaligned with the work life. So if you're someone who's late, and goes to bed at 1 a.m. but has to wake up at 6 a.m. because they need to commute to work, you're obviously going to experience more health conditions because you're not getting the sleep that you need. And your body is in like this chronic state of mini circadian dysregulation. What we did, in fact, recently found during one of the COVID studies that I was talking about, because so many people were in lockdowns early on during the pandemic and didn't have to go to commute, didn't have to worry about waking up too early in the morning. We found that there was no difference between people who were more morning preferences and evening preferences in terms of their mental health, at least. And that people who were more evening were actually feeling much better during the pandemic just because they could do things based on their routines. So I think those are some of the misperceptions that are there in the media, in television, etc., that I think we need to get rid of a little bit. Obviously, I'm very passionate about this.
Yeah, well, I mean, as you should. I think our society puts way too much pressure on. There's a right way to do something, and there's managing energy levels as opposed to managing tasks. And like when do you feel your best? I'm a morning person. I'm useless after lunchtime. In the morning, I can I can get a little bit productive, right? And I think it's managing those energy levels to when you feel great, and then you do the tasks around that. But easier said than done. It seems like there's a portion of sort of human universals when it comes to circadian rhythm, and then there's a point of everyone is different, and there's no one size fits all, and that line seems quite blurry. What would you put in the sort of universal bracket, and what would you put in the you got to figure it out for yourself? Everyone is very, very individual and different. I mean, I imagine the view morning lights would be in the universal bucket. I mean, how would you think about that question? To sort of
Yeah, I guess that's a very good point. I think we are all similar in some ways, in the sense that it's universal that you should. Sleep Health Foundation recommends, in Australia at least, 7 to 9 hours of sleep. And I think that's universal for most people, give or take a little bit more. Like some people might feel really amazing at 8 hours, some might feel really amazing after 8.5, but like 7 to 9 is a universal thing. We should, if you're an adult, that's how much sleep you should be getting, period. The other universal things are around consistency. So we all need consistency in behaviors, regardless of whether you are a more morning chronotype versus whether you're more of an evening chronotype. So I think those are the two main key things that we can all be focusing on. The other one, obviously, is light. Regardless of your chronotype, in some ways, if you try mimicking light the same way it happens in nature, so like start off your day with bright light, and like towards the end of your day, regardless of when you go to sleep, if you start dimming down the lights a little bit, half an hour before your bedtime, that are three sort of universal things that I would say. And then other things that I guess are different across individuals is what kind of work you do. So if you are a shift worker, you would need different treatments and interventions to someone who is not a shift worker. So for instance, we know that if you are suffering from insomnia, the most common therapy is called cognitive behavior therapy for insomnia. And one of the things that it does is it restricts your sleep. It tells you these are the hours that you're going to be in bed, and that's usually about 6 or 7 hours. You can't say the same to a shift worker, because that can be detrimental for their health and the kind of work that they're doing. So shift work is one. The kind of work that you're doing is going to be different, and therefore your solutions are going to be different. The other one is chronotype. Depending on what chronotype you are, you might want to structure your day a little bit differently. So if like you are a morning person and you feel like before lunchtime is when I'm at my best, that's when you want to do the tasks that are perhaps require more of your effort or more of your cognitive abilities. Whereas if you're more of a later person, you might want to figure out, okay, I feel most productive in the afternoons, 2 to 4, or like 5 to 6 in the evening. That's when you do the bulk of your tasks. So that sort of structuring of when you're doing most of your tasks probably is a little bit different for every individual.
beautifully put. I love that. That's a real concrete takeaway, which is yeah. I mean, that's valuable for me. So thank you very much for that. There's an ironic question here of, okay, how can technologies help us with this? Which is sort of like, I guess, ideally you just align with how the world works, and the sun would be the be all and end all, but obviously you can't completely restructure society to make that a thing. So how can technologies help us?
So many ways. I'm a very I'm not necessarily skeptical of technologies. I'm someone who embraces it in many different ways or forms. I think light is one of the best inventions known to man. Like it's or women or anyone. Um, it's one of the things that has helped us feel more safe. It allows you to go outside in the dark without feeling the need to look back and see who's behind your shoulder and that sort of stuff. So I think light is one of the main ones. So you can use technology essentially where you can to perhaps even tone down the intensity of your lights at night and make them brighter in the morning. If you're living in a place that doesn't have enough windows or enough sunlight, so you can use light as almost like an alternate to sunlight. That's one. The other ways I think technologies are really useful, at least what I've found, is in terms of what sort of treatments you can receive. So again, we know that light glasses are great for if you have jet lag because you've traveled from one country to the other. In terms of treatment for seasonal affective disorder, where you experience symptoms of depression because there is no bright light, which is something concerning because we in Australia are entering into winters now, so it's getting darker and we don't get enough sun at the moment. So that's another way. But also, if for some reason you don't have access to face-to-face treatments, or you don't know where to go for treating insomnia and that similar sorts of condition, digital technologies can help you. We sort of made headway in telehealth and using technology. So we know that things like cognitive behavior therapy for insomnia, for instance, is very well delivered digitally. Like you can go on websites. I know in UK, there's a website called Sleepio, which offers cognitive behavior therapy for insomnia. In Australia, we have This Way Up. In US, there are multiple other websites and technologies that you can use to just get treatment for insomnia in your own hands instead of, waiting on lists to get those treatments. So I think we just need to learn to embrace technologies and just need to learn when to avoid them. Closer to bedtime, probably not the best idea. But other than that, for your lights, for treatment of insomnia, for treatment of other conditions, even shift work related conditions, they're really just such an accessible, scalable way.
So, okay, so you're quite bullish, quite believing quite strongly that the fact that technology could really move the needle in terms of moving us away from circadian dysregulation and help with things like insomnia. What would you say to someone who said, okay, that's great, but aren't smartphones perpetuating the problem? So if the solution is in the device that's causing the issue, how would you speak to that?
I would say everything in moderation in some ways. So you can embrace technology, but still know what are some of the issues with it. So I can embrace it, and I can get everything I want from technology during the day. Or when you're coming close to bedtime, about 2 hours before, maybe even 3, try to reduce phone use a little bit, because we do know that the light from your phones is affecting melatonin production. But we also know that just the act of going through the phones, like even on the lowest brightness setting, if you're scrolling down on TikTok, if you're looking at Twitter or X, as it's now called, that's going to affect you. That's going to affect you from unwinding after your day. So maybe just know that there's a difference between using technology for fun purposes and then using it as like a revenge bedtime procrastination, as people like to call it, because that's when you use your phone apparently. That's probably not going to help. So everything in moderation.
Well put.
Also, I do want to say, I'm not trying to be prescriptive when I say these things. It's like I'm not telling you from a space of like, do this, do that, do this, but more from a perspective of this is what science says, this is what evidence says. My goal is to empower people who might be listening to this, and they can pick and choose what they think works best for them. But yeah, do like at least 2 things that I think most people can give it a try is reduce the lights that you get during the evening hours, reduce your phone usage, and see how you go for a week or so. And you would likely notice a difference in both in terms of the duration of sleep you're getting, but also the quality of sleep that you're getting.
So, I mean, that leads me to my next question is, I think it's a really interesting lens to view humans through and to learn about humans as individuals and as groups. Firstly, what have you learned about how humans are through your studies? And then how has it affected how you show up in life from a circadian point of view?
So it's something that I've thought of a lot before and quite recently. But it's also something that's also quite challenging to respond to. The first key thing I believe that I learned really quickly was how humans are quite different as individuals, but also different we are as communities and groups. So one of the main things that I've been looking at in the last year or so, and will be doing in more foreseeable future, is to learn how sleep is so different across communities. So just for instance, we know that in certain countries, in more sort of Western societies where it's, for a lack of better word, it's quite individualistic. So we see sleep as quite an individualistic behavior. If you were to come to me with a problem such as insomnia, your treatment would be very individualized in the sense that I would be looking at you as a person and say, okay, these are what your issues are. This is how we deal with it. Um, what I think I found so fascinating and so interesting to learn is that when you go into cultures where it's perhaps a bit more collectivistic, there are more people sleeping in the same room. It's seen as a more sort of group behavior in some ways. Again, for a lack of better word, the treatments just change so much. So, for instance, we recently have been doing a study with people living with dementia and people who are caring for them. So they're still in their family environment. And what we quickly realized was that when we spoke to community members, they were like, "Oh, we don't really want individual sessions. We would like to have some group sessions where there are more people like us who can share similar experiences and we can talk to them about how we are feeling." And that just goes on to show that maybe how we think about sleep, which we do as an individual, is actually more of a group behavior. Or we need to involve partners more into those treatments around sleep. And that just is such an eye opener for me, and something that I would love to work on in the future is like, see how do we involve people as communities and groups and talk about this as an area, as a health area that's really critical and really important to think about.
That's so fascinating. I'd never really thought of it from that perspective at all. But I mean, just thinking about it now, most people spend most of their sleeping time sleeping next to somebody else, right? So it's not this individual pursuit.
I do want to bring a fun sort of statistic, not a fun statistic to this, but just an interesting one. Most of the complaints around snoring, which is often a sign of obstructive sleep apnea, which is a common disorder, are usually brought on by partners. It's like, my partner can't stop snoring, I can't sleep. So they are experiencing a sleep disturbance because their partner snores. But I was just looking at a recent statistic that said that 1/3 of separations or divorces have some form of link to sleep disturbances or problems around sleep. And there are two things that are associated with it. One is people might have those like mismatched chronotypes. So you might be a more morning person, but if your partner is a more evening person, you're disturbing each other's sleep in some ways. Obstructive sleep apnea is another one. But also the fact that if you do have sleep disturbances and you're not getting the right quality, quantity of sleep, you're more likely to have arguments, you're more likely to find the other person irritable, and everything they say, you're going to be like, why is this person pointing at me? So I found that as a really interesting statistic to look at, that there's such a large majority of divorces and separations have one common reason: it's sleep.
It kind of brings back to where we started with I'm going to butcher the term, but the frontal lobe disinhibition, right? So it kind of brings it full circle of like, if you're really tired, don't have the argument, sleep on it, then have it out in the morning, perhaps. I think that's wonderful advice, and sort of this oblique relationship advice as well through the research on sleep. I think that's wonderful. Where do you see this research going? And more specifically, if you could know something, what would it be, and what are you really excited to learn about over the next 10 to 15 years in this field?
I would go back to sort of that tailoring treatments bit. Chronotherapeutics is such a large and upcoming area. There's obviously a lot of headway that we've made in terms of treatment for depression using light, treatment for seasonal affective disorder using light. But we're also seeing chronotherapeutics getting into other areas as well. So, for instance, we know that high blood pressure medication in certain cases are now given closer to bedtime or a few hours before bedtime. And we know that that prevents heart attacks in the morning because that's the most common time when people would have attacks. And that reduces the risk.
Is that because of the
Yeah,
cortisol spike?
yeah,
Oh, right. Interesting.
exactly. So we're already getting to a point where like chronotherapeutics is like slowly getting into, and not slowly, I think there's already a lot of headway, but we can see that it's like clearly getting into medicine in general. But I'm really excited about what's going to happen in the next 10 or 15 years when it sort of becomes the forefront and we know that, okay, these medications work for people. We need to find the right or the best time to give it to them.
That's wonderfully fascinating. So the timing of a medication could affect how efficacious it is, purely around your circadian rhythm. Wow. Okay. And are you going to be directly involved in chronotherapeutics? Are you going to be studying this?
I hope so. I'm not a biologist in particular. So my degree is in psychology. But I think that there are certain elements to it that definitely are something that I could be involved in. So I can't describe it, but I can surely do a trial on it, which would be fun. Yeah.
Lovely. Lovely. Well, where can we keep up with your research? You know, when you do these trials down the line, where can we find you?
Yeah, I'm on X by my first name and last name, so you can find me there. I usually share lots of research insights there, really little tidbits of like what's happening in the research world. My research papers usually are on Google Scholar, so if you just type my name, it would come up there. But yeah, Twitter, X is the place where I'm most active.
Wonderful. Well, Dr. Prerna Varma, thank you so much for coming on. I learned loads and I really enjoyed talking to you.
Thank you so much for having me, Bennett.